If your dog has been sleeping more than usual, eating less, and pulling away from you, this video is for you. Not because something is definitely wrong, but because the signs we're about to cover are the ones most owners only recognize in hindsight, and you deserve to know them now while there's still time to act on them. Welcome to Canine Mind. Subscribe now, because what we cover here matters. There is no harder moment in a dog owner's life than the one where you begin to wonder whether your dog is telling you something you're not ready to hear. Most of us aren't taught how to recognize what the end looks like for a dog. We're not taught how to read the signals, how to understand what our dog needs from us during that time, or how to make decisions that honor the life they've given us. That's what this video is for. 12 signs that a dog may be approaching the end of their life, what each one means, what it doesn't mean, and how to be present for your dog through all of it. Sign number 1, loss of interest. One of the earliest and most misunderstood signs is a quiet withdrawal from the things your dog has always loved. The toy they've carried since puppyhood sits untouched. The treat that once made them appear from anywhere in the house no longer moves them. They watch you from across the room instead of meeting you at the door, and something in their eyes has changed. Not distant exactly, but further away than it used to be. This withdrawal is not a sign that your dog loves you less. It's important to hold on to that. What it reflects is the significant energy required by every act of engagement, energy that is now being used elsewhere by a body working harder than it ever has. As cognitive function declines toward the end of life, dogs can also experience a kind of mental quietness. The world becomes less urgent. The things that once sparked them become harder to reach. If you notice this in your dog, the response isn't to try harder to engage them. It's to be present without expectation. Sit beside them. Let them know you're there without asking anything of them. Your presence is the thing they still want, even when everything else has faded. Sign number 2, lethargy and physical weakness. Dogs are designed for movement. Even the laziest dog has a baseline of engagement with their environment. A lift of the head at a sound, a trot to the door when the bell rings, or repositioning when the sun moves. When that baseline disappears, when your dog lies in the same spot for hours without shifting, without responding, choosing the quiet corner of a room rather than the center of activity, that stillness means something. The specific quality of end-of-life lethargy is different from ordinary tiredness. It doesn't resolve after rest. It's not improved by a walk. Routine things that were once automatic, getting up to eat, moving to go outside, coming to you when called, begin to require visible effort. And sometimes that effort isn't there. You may watch your dog try to stand and settle back down instead. You may notice they've stopped asking for things they always asked for. This isn't your dog giving up. It's your dog's body redirecting every available resource toward the work of simply existing. Recognizing the difference between tiredness and this kind of withdrawal allows you to respond to what is actually happening rather than what you're hoping is happening. Sign number 3, changes in breathing. Changes to how your dog breathes are among the most medically significant signals to watch for, and they deserve immediate attention. Panting at rest when there has been no exercise, no heat, no obvious reason is not normal. A cough that is new or that has worsened over days is not something to wait on. Breathing that looks labored, shallow, or irregular, especially during sleep, should be seen by a veterinarian. The underlying causes of these changes vary. Heart failure, which affects the heart's ability to circulate blood effectively, is one of the more common. Respiratory disease, cancer, kidney failure, liver conditions, and metabolic disorders can all manifest through changes in breathing because the lungs and the cardiovascular system feel the impact of almost every major systemic illness. What matters most is this. You know how your dog normally breathes. You've heard it beside you for years. When something changes, you will notice it before any test confirms it. Trust that noticing. Breathing changes are the body's way of communicating urgency. Listen. Sign number 4. Loss of appetite and thirst. Food has been a constant in your dog's life since the day they arrived. They knew the sound of the bag, the timing of the bowl, the specific spot where it was placed. When a dog stops eating, genuinely stops, not a skipped meal, but a sustained and deepening disinterest in food and water, it is one of the most telling signs that something fundamental has shifted. As the body approaches the end of life, the digestive organs begin to slow and eventually cease their function. The signals of hunger and thirst, which have driven your dog to the bowl every day of their life, simply stop arriving. Food doesn't appeal because the system that made food appealing is no longer running. This is not suffering. It is completion. If your dog continues to take small amounts of food or water, but struggles to keep them down, you can offer gentle hydration using a dropper near the lips. But if they turn away entirely, the most loving response is to follow their lead. Their body is telling you what it needs. Part of caring for a dog at the end of their life is learning when to stop offering what they no longer want and simply to be with them instead. Sign number 5. Visible weight loss and muscle changes. The physical change can be striking. A dog who was full and solid weeks ago may appear visibly thinner, the ribs more prominent, the face narrower, the haunches shrunken. Muscle mass that was built over years of walks and play recedes quickly when the body stops receiving nutrition and begins redirecting what little it has toward more essential functions. This visible decline is often the sign that brings owners to the moment of real recognition. Because it is impossible to explain away, it is hard to look at. If you find yourself struggling with what you're seeing, that difficulty is appropriate. It means you are paying attention. Witnessing this change clearly, without minimizing it, is one of the ways we honor what a dog's body has carried for us across their whole life. Sign number 6. Loss of bladder and bowel control. A dog who has been house-trained for years, who has never had an accident since puppyhood, may begin having them regularly as the end approaches. They may not move to a different spot. They may not even seem aware that it has happened. This is not a regression in training. It is not a behavioral problem. It is the physical reality of organ systems that are slowing down, combined with the energy it takes to simply get up, which may no longer be available to them. If this happens with your dog, respond with gentleness and no correction. Clean them quietly, keep them dry and comfortable, and understand that what you're seeing is the body's process, not your dog's choice. The dignity of how you respond to this moment is one of the most concrete ways you can show your dog that their comfort matters more than anything else. Sign number 7. Behavioral changes. Some dogs in their final days seek more contact than ever before, pressing against you, following you with their eyes if not their body, asking for touch through small persistent gestures. Others move in the opposite direction, withdrawing to quiet spaces, preferring to be alone with whatever they are experiencing. Many dogs move between both, seeking you out in 1 hour and retreating the next. Restlessness is also common. An inability to settle, a slow repositioning from one spot to another without ever finding ease. Disorientation can accompany this, a kind of confusion about where they are or what is happening, that shows itself in the eyes and in small hesitations of movement. Some dogs whimper or shake, not from dramatic pain, but from the accumulated discomfort of a body that is no longer working as it should. If your dog shows aggression when touched during this time, understand it immediately as pain communication, not personality. A dog who flinches or snaps at handling they would normally accept without reaction is telling you precisely and honestly where they hurt. This is not the time to push through. This is the time to adjust. Sign number 8. Decreased mobility. The walk that your dog has taken every day of their life may become something they approach and then abandon. Steps they've climbed 1,000 times may stop them. Getting up from lying down, a motion so automatic they've never once had to think about it, may take visible effort, may require 2 or 3 attempts, may sometimes fail. What you may see is a staggered walk, legs that tremble under the body's weight, a collapse that happens without warning. In some cases, the loss of coordination can be significant enough that the movement resembles a neurological event, with muscles that discharge energy without control. This is the body's motor systems losing the reliability they've had throughout your dog's life. Watch this, not with urgency that frightens your dog, but with calm attention that allows you to support them when they need it. Help them up when they struggle. Remove obstacles from the spaces they move through. Bring food and water to where they lie rather than asking them to come to it. Sign number 9. Pain and discomfort. Pain in dogs is not always loud. Many dogs carry significant pain quietly in ways that are easy to miss if you're not looking for them. Changes in posture, a back that hunches, a head held lower than usual, a reluctance to shift position, a breathing pattern that quickens when touched in certain places, eyes that are slightly glazed or that close more than usual, panting that persists without a physical cause. These are the quieter signs. The louder ones, whimpering, crying out when moved, refusing to bear weight on a limb, are easier to recognize. But by the time a dog is expressing pain that audibly, they have been managing it quietly for some time. If you suspect your dog is in pain, this is a non-negotiable veterinary conversation. Pain management at end of life is not an indulgence. It is the foundation of everything else you can offer your dog in their final days. A dog whose pain is managed can rest. A dog at rest can feel you beside them. That presence, calm, warm, continuous, is the most significant gift remaining available to you. Sign number 10. A cool body. As circulation slows toward the end of life, the body's ability to regulate temperature decreases. You may feel this first in your dog's paws, which can become noticeably cooler to the touch than the rest of their body. Their breath may also feel cooler. The body temperature drops as the heart's work reduces, and the warmth that has radiated from your dog through every season of your shared life begins slowly to change. This is a natural process. If you feel it, add warmth. A blanket placed over them, your hand resting on their side, your body beside them on the floor if that's where they are. They may not visibly respond, but they can feel the warmth you offer. And in the final stages of life, physical warmth and human presence are the same thing. Sign number 11. Persistent vomiting or diarrhea. Occasional gastrointestinal upset is part of normal dog life. What you are watching for is something different. Vomiting or diarrhea that is continuous, that doesn't resolve, that the body seems unable to stop regardless of what is offered or withheld. When the digestive system can no longer function with any reliability, it creates conditions for rapid dehydration and malnutrition that accelerate the overall decline. If you are seeing this in your dog, the first step is always a veterinary conversation to understand the cause and assess what, if anything, can be done to offer comfort. If the answer is that nothing can reverse what is happening, then comfort management becomes the priority, keeping your dog clean, dry, and as physically settled as possible. Sign number 12. Changes in gum color. This sign requires you to look at something most owners rarely check, but it is worth knowing. Healthy dog gums are a warm, moist pink. When you press them gently and release, the color returns within 1 to 2 seconds. This is called capillary refill, and it reflects how well the blood is circulating. Gums that are turning pale, white, blue, or grayish, or yellowish in color are communicating serious systemic problems. Pale or white gums indicate poor circulation or significant blood loss. Blue or gray gums mean the blood is not being oxygenated adequately. This is an emergency. Yellow gums signal liver involvement. Any of these changes observed clearly means your dog needs to be seen immediately. Check your dog's gums occasionally, not in a clinical way, but in the way of someone who wants to know their dog's body. That familiarity is what makes change visible when it matters most. Now, what do you do with all of this? The honest answer is that this knowledge is not meant to make you clinical or watchful in a way that takes you out of the relationship. It is meant to keep you present. A dog at the end of their life needs one thing above everything else: you. Sit with them. Speak to them in a low, steady voice. Understand that your emotional state moves directly into their nervous system. Dogs feel our distress with the same precision they feel everything else about us. Your calm is a gift you can give them when almost everything else is out of your hands. If they want to be held, hold them. If they've moved to a quiet corner, bring their bed there and sit beside it on the floor. Moisten their lips gently if they're no longer drinking. Keep them warm. Let them sleep. And if the moment comes when a veterinarian tells you that their pain cannot be managed, that their body has reached the end of what it can do, understand that the decision to let them go peacefully is not abandonment. It is the final act of the love you've carried for them their entire life. Dogs give us everything for every year they have. At the end, what they need is for us to be brave enough to be present, not to fix it, not to stop it, but to be there completely until the very last moment. That's what they've always done for us. Subscribe to Canine Mind if this video meant something to you. And if someone you know is going through this with their dog right now, send it to them. Sometimes the most important thing is just knowing that what you're seeing has a name and that you're not facing it alone.